asking what is intersectionality is a fantastic question, and I get that question all the time. So I look at intersectionality as a framework for better understanding my clients. So when my clients come to me and they identify with multiple marginalized categories, so for example, a Latina who is also disabled, or an African American who is also bisexual, there are many, many iterations of these identities. And so we think of that as a way to consider these multiple socially constructed identities and create this model for understanding the impact of those, knowing that that may vary by situation. So it's a way to help us understand our clients, and it's just a framework to help us understand what their experience is like outside of the therapy session. There are lots of ways that clinicians can use this intersectional framework to help support clients. One way that it can be helpful is helping them to see what does intersectionality look like in their daily living. So one great way to understand that in a very concrete way is this idea of microaggressions. So microaggressions are these small, tiny insults that happen throughout the day, sometimes once or twice a day, sometimes many, many times. So for example, if you have a transgender client and they've been misgendered through pronouns that are inappropriate or not consistent with what they prefer to be called, that's a microaggression. And so I think of microaggressions as kind of like paper cuts. Like a paper cut can really sting and can bother you for a long time, but you know it's supposed to be small. And I find that if we can help people understand what that looks like outside of session, hopefully also avoid microaggressions in session, and help them to also find support, understand how these intersectional identities can also impact their conceptualization, right? So I also use intersectionality to help conceptualize and for treatment planning. A lot of people have concerns that they are unintentionally microaggressing against clients or even other citizens in their everyday to-day interactions. And I want people to know that it's going to happen, and there are multiple things that we can do to work on this. So the first thing I would say is we're all on this journey together. So just because I've been doing this for a long time doesn't mean that I can't make a misstep. So I think part of this is an attitude that says, I am gonna try harder, I'm gonna do better, and it may take me a while to get there, but I'm gonna be responsible for where I am in the process, and I'm gonna take ownership of my mistakes. So the first thing I think is to recognize where you are right now. So I believe that recognizing your own personal bias, and there's multiple dimensions here to consider, that you will first recognize that you have some bias. Also, I think it's important to recognize that privilege and oppression are two sides of the same coin, and there are multiple coins. So you want to recognize where you are on different dimensions. All of us sit in multiple places on the different dimensions. And so it's helpful to take some time and kind of recognize that depending on the context and the question being asked, you may or be on the oppressed side or on the privileged side. So I think that is an ongoing conversation that we're going to have to experience for the rest of our clinical careers, and know that it'll change, right? So as we become older, or we develop physical problems or become even disabled, again, your position on that dimension might change. So I think that being in that conversation is an ongoing conversation. It's really more of a discourse. So another thing to consider is just is when you make a mistake, if you microaggress against someone and you give them an honest response, which is that I made a mistake, I made a misstep, own it, apologize for it, and try to do better. I think it's like any other therapy rupture where you acknowledge the misstep and you own it, and then you honestly try to do better. People respond to genuine apologies, and people know when you really are trying and they're forgiving. So I think privilege is difficult for a lot of us to talk about or own, because privilege is essentially an unearned power or unearned credit, right? So not everyone gets privilege and it's not earned. And so I think that in a society that is people often focus on, I earned everything that I got, I work hard, it's a meritocracy. I think to acknowledge that you are simply given this privilege or this unearned power, it's uncomfortable, it's unsettling. I think that that's part of the reason why I talk to people about acknowledging the different dimensions. So in some instances, I do have privilege. In other instances, I am marginalized. So there are some cultures that do not feel comfortable engaging outsiders in advice or mental health practices. For some cultures, it is considered to be shameful to ask for help, especially help from a professional. And we have to remember too that the idea of therapy is a largely Western culture. So there are other parts of the world where they don't really value clinical care to the same degree that we do in Western culture. So there are many people who have a cultural barrier. I think that another piece of this is also a general lack of trust. So I believe that if you want clients to trust you, you have to earn that trust. You can't just walk in the room and say, I'm the provider, you should trust me because this is my job. I think it's more complicated than that, and I think people really need to earn that trust. So some of it is based on the individual situation, and some of it is based on much, much larger pieces. The other thing to consider too is that if someone has had a negative experience before in some sort of clinical or counseling role, then we may need to kind of overcome that as they recover or kind of move forward. I feel that it's a big part of meeting the client where they're at. So if I have skills to impart, if I have knowledge to share, I need to find a way to help that client hear what they need to hear at the right time. And so this is part of where cultural competence comes in. It's helpful to know, what sources of information are valid and legitimate to this individual based on what they've told me about their family or about their beliefs or about even their fears. So I think it's very important to meet the client where they're at, and that often requires a multidisciplinary or a multidimensional team so that you can do more of the wraparound services and meet them where they're at so they can get those needs met as effectively as possible.